Hi, I'm Dr. Jason Popp of the Family Healthcare Clinic and Rochelle Community Hospital. I've been asked to go over some basic elements of mask use as it pertains particularly to the hospital and the clinic mostly. And what we have here today are different kinds of masks. You're familiar with some of them, I'm sure, and you may not be familiar with some of the safety precautions with others. Some of the basics that we have when you first get to the hospital or clinic is a surgical mask. Now, these type of masks have a color on one side typically and are white on the other side. The color side faces outward. There are two sections of them, a top that has a metal inside of it and the other side is just cloth. What you have to do first is take the metal side and make an indentation for your nose. And then before you put it on, you should pouch it out a little bit like that so that it goes over your face appropriately. And then using the ear loops, fit it such that it is snugly over your nose and below your chin. Improper ways to wear this, of course, would be to have your nose showing or to have your mouth showing. It should be like this if you are wearing this type of mask. One thing that I've noticed in town is that some people are wearing masks that have vents in them. These are construction style masks, and these masks have been made with dust in mind and other elements of a construction site. Here's one of them. You can see, if I can get this on appropriately. Yeah, this is great, huh? So, this mask is perfectly protective of me from a mouth standpoint, but anytime I breathe out, there is nothing blocking the flow of everything that I am exhaling. Meaning that these are not good in the particular situation of viruses. They have little mask valves, and I'll see if I can open it here. The mask valve has just a little plastic spacer that has absolutely nothing between your mouth and the outside world when you exhale. The problem with these is they are not good for healthcare. So, if you wear a mask that has a valve on it and you come to the hospital or clinic, a couple things will happen. One, we will either ask you to continue to wear your mask and then put a surgical mask over it if you prefer the protection of the mask that you have. Or, of course, we will just give you a different mask so that you can wear a mask like this and then you can take this home. Don't get me wrong, I understand that masks are difficult, it can be very confusing. The problem is that these masks are not good for public health. If I see somebody using a mask with a vent, I try to walk away from them because I know it's really not doing anything to protect others. There are some masks out there that are N95s in public that don't have vents. I was able to find one here. It is a construction grade N95 by 3M called an 8210. And the 8210 actually doesn't have any type of vent on it. I do know that, I think it might be 8211, I'm not sure what the number is, but it does have a vent on it, and that just doesn't work very well for the hospital or clinic. Nobody can tell you what to do when you're out in public. The recommendation is for you not to wear a vent though, because basically it's defeating the point of protecting others. And this might be a good time to throw out a reminder that these masks and practically any mask is not really for the wearer's protection, but rather to protect the people around the wearer. The coughing, the loud speaking, and even normal speaking has been shown to expel particles which theoretically could expel virus also. When we're in the hospital, we have N95s also that look like this. Just a basic 3M. There are some other N95 types beyond that. Something else that works very well for public use would be a good cloth mask. Now, we're not talking about something that's tissue paper thin. We're talking about, basically t-shirt style thickness. I know that the World Health Organization has listed some information about different materials that can be used for masks, and they also have listed the basic filtering principles for most of them, and they give gauges. I will have to see if I can link to that. Perhaps we can put it on our page because it's a little bit longer to read through. In the last 4 to 5 days, both the CDC and the World Health Organization came together, and they both agree that masks are recommended for potential prevention of spread of COVID-19. In the beginning, it was confusing because the initial reports were one way or the other. Some said, use a mask. Others said, don't use a mask unless you're in the health field, and then use a mask. Now everybody has landed on the same page based upon more recent research. Another thing that I would like to address is in public, sometimes I have heard comments such as, wearing a mask can increase your risk of COVID-19, and that's not actually true. It does not increase your risk of getting the virus. What can be confusing is that wearing a mask, while it can help you not exhale particles when you cough, it still leaves your eyes open, and transmission of this virus can be through the eyes. So if you're wearing a mask, even if it's tightly fitting, you could still contract the virus if somebody around you exhales particles and they land in your eye. In the hospital, we wear face shields or goggles and masks, typically the N95 masks, which are noticeably more snug. I do realize that it is very hard to wear a mask. I do wear a mask most of the day, so I'm very familiar with it. I thank the people out there who are trying their hardest to wear the masks. The general consensus right now, as of this date on June 7, 2020, is that if you can publicly distance by at least 6 feet, you don't need to wear a mask. However, if you cannot publicly distance by 6 feet, it is recommended to wear a mask in public. And in the hospital and clinic, it is required. The other thing that I have heard in public is that there is a concern for wearing masks and inhaling carbon dioxide to the point where you could pass out. For most people, the studies have shown that wearing a mask is completely safe. However, there are some indications that if a person has severe breathing difficulties, and on top of that, they wear an N95 style mask, one of these thicker masks, then they could potentially have more difficulties with breathing. That is true. However, no study has been shown that a person with respiratory disease wearing a standard surgical mask is going to have difficulties breathing. So if you do come to the hospital and if you have breathing difficulties, you can use this mask, and it is something that should not cause you breathing difficulties. I want to take a moment to just address the public and say thank you for social distancing, thank you for disinfecting, thank you to all the essential workers. It is very important for the healthcare team, and what we are striving to do is keep the curve flattened, because that means that we have a good amount of resources to deal with the people who are coming in who are sick, and that is very important. Fortunately, the numbers have been able to be kept down this way. Unfortunately, we still have had some bad cases. So at this time, what we can do as a population is try to just respect one another. If somebody's not wearing a mask and you get close to them, instead of getting angry, just a friendly reminder. It's just important to try to remember that everybody has their own hardships, and everybody has had an impact from this coronavirus in their own ways. There's no way that we can see how they've been impacted by it. We just have to try to be patient. And if we are patient and if we are kind, we can certainly get through this together. And I know all of you out there are going to do your best for this. I know I'm going to try also. I know I get frustrated, and I know you get frustrated too, but all we can do is ask to try to follow the guidelines for now, because it's the best that we have. And when we get new guidelines, when we get new information, if we get new drugs, if we have new therapies, we're going to try to stay right up front with those for you. So thank you very much, and please just do your best.